And it really is sort of a non-specific syndrome. It has lots of different manifestations. So some people can have what we call general symptoms, fatigue, kind of mental fogginess, or brain fog is the other term. Some people can have neurologic symptoms like kind of pins and needly symptoms or muscle aches, sort of kind of non-specific. Other people might have prolonged gastrointestinal symptoms, stomach upset, diarrhea. There are folks that have continued shortness of breath or breathing problems, heart palpitations associated with it. And you don't have to have a certain number of things in each category. You might have 2 of these things. There's no one diagnostic test. There's nothing that your healthcare provider could say and do to say, you have post-COVID syndrome. And people definitely have lingering symptoms after COVID, and they don't have post-COVID. We generally say you have to have this, whatever constellation of symptoms, for at least 4 weeks after having COVID. So I think that's an important distinction, that I think anyone that's had COVID, or lots of people that would have COVID, would have said, boy, it took me like 2 weeks to really feel like I could go back to work and feel like I could concentrate and feel like I was getting back to myself. That in itself is not post-COVID. It has to be 4 weeks from, generally speaking, 4 weeks from COVID diagnosis. So I wanted to make sure I said that. There is no specific treatment for it. There are a lot of studies looking at post-COVID syndrome. There's studies going on here at UVM as well, but there's a lot we don't know about COVID. And I think that's the one thing that COVID is teaching us, is every time we think we know what's going on, it sort of changes the game a little bit.